Kathy and Jamie, I guess, give us a report on COVID-19 for this week.
Good morning, and thank you, Mr. Chair and Commissioners. I don't know if you can hear me with my mask on. So I handed out the numbers. From today's date, you can see that our confirmed cases are in Clay County are 5,799. So actually the confirmed cases have gone up. There are about 320 more cases than there were in December 2nd. So we do have an increase in the positive cases. I think when Commissioner Campbell was talking about a decrease, we're seeing a decrease in active cases. And part of that is we're getting people out of isolation. There was a kind of a glitch with a number of cases being followed with the Minnesota Department of Health. There was quite a lapse, so we're seeing a bit more of the numbers varied in the active cases, and then we're reporting those that were out of isolation. Some of those cases were not even caught during their period of isolation, so we're seeing some variances there. So it's a difficult to just see those numbers without having the understanding about what was happening. So we're still seeing increases in the confirmed positive cases. However, the testing has been down. So when we look at maybe they're not increased as much as they had been, we're seeing that the testing at the same time, across the state of Minnesota, the testing numbers have gone down. So we can't correlate that suddenly we're getting quite a decrease in numbers because the testing will catch those positive cases, and with the testing numbers down, then you're going to see less of those cases. For example, even in our saliva testing in Moorhead, the increases of testing, we had a large increase the week of November 15th. We had about 1,000 more that we tested. And then it decreased after that. So we had approximately 700 less testing done that week of November 22nd. And then again, another reduction of close to 300 the week of November 29th. Now this latest week, we have about 625 less tests. So we're seeing even the last few weeks, the decrease in the testing in the saliva site. And so that's just one example where that's in Clay County, but across the state they're seeing less testing, so clearly then the positive cases look less. So we don't want to, we still want to keep in mind that this virus is not gone away. We're still, the majority of the spread again is still in the large gatherings, people that aren't masked. So we're really seeing that's really, and across the state, that's the example of where they're seeing it. But we're still high, and we still need to recognize this is a situation that we can't really become lax in. So our message continues to be the social distancing, the masking, avoid the large gatherings. As large gatherings without masks is where a lot of it is happening. So we really want to be conscientious about continuing what we're doing now, to keep the spread lessened. So I expect that we'll maybe see some increase in testing as we go along now this month, but we'll see how that goes as the numbers of tests decreased. So it's interesting that we're seeing that decrease, but that explains a little bit about why you're seeing the discrepancy in numbers. We're still seeing the number of deaths also. We have 69 in Clay County. So the number of deaths have varied on the spreadsheet, if you'll see, just because they weren't actually put in at the time of death. So they've been added later. So we're seeing 69 deaths now as a total for Clay County. And then you see the number of deaths in Minnesota as well. The cumulative deaths are the 4,462, and we've hit over 300,000 deaths in the United States. So we're still seeing those numbers. And then the 14-day positivity rate, now granted that's only through November 28th because of the number of cases that come on. To get an accurate number, you really can't project any further than that. We can have our staff looking at all of our cases and trying to project a 14-day case rate, but it's not as accurate as doing the 2 weeks behind. So it went down a little bit from the previous 2-week period. It's at 186 now, but that 14-day case rate is quite variable. You can't project that day to day and be accurate. The cumulative. Oh,
I have a
sorry.
question. On the Clay County daily new cases, the graph, you only have the new cases until November 22nd. Can you
Yep.
tell me why?
Yeah, that's as far as she got with the graph. We have the, we don't have the additional new cases because of the delay in the, so there is quite a delay in getting them on from the Minnesota Department of Health to our med system. So sometimes that is a delay. I'm not sure why it only shows through November 16th. I'm not sure about that graph. I can check with them and see, but it shows our confirmed cases on the following page through December 9th. And then our confirmed cases for today, December through December 14th.
Because I am tracking our daily new cases personally when I see them reported every day, and they are on a trek down. And I understand that there's a delay, and I understand that we're still in a critical point, and I agree with you.
Yep.
But we also have to admit that the measures that were taken have worked to slow the curve. And if you look at the data, it will show that that curve has slowed. And I think it's important for people to know that too.
Yeah, I think those people that are masking and social distancing and not being in large gatherings, that all is measures that we need to all be conscientiously aware of. But the fact is the numbers continue to increase a little bit, so we're not on a downward trend yet. But we should, hopefully with the vaccine coming out, and Jamie will talk about the vaccine distribution, once we can start vaccinating, that also helps, but it's going to take quite a long time before we even get to the vaccinations for the general population. So our amounts of vaccine will be less, but Jamie will talk about the vaccine
I have a
distribution.
question for you, Kathy.
Yes.
Where are these large gatherings without masks or social distancing taking place?
Just in the community, but that's across Minnesota, they're noticing that. So large gatherings.
I'm not seeing any of that here.
Yeah,
Can you give me an example of where that's taking place?
I cannot, but the schools are reporting that as well. So when they see large gatherings, that's when their numbers go up. And I don't know where the large gatherings are happening. It might be in homes, it might
That's
be in,
supposedly the primary cause of COVID spread,
yeah.
but I can't hear an example of it.
Yeah, I can't give you an example in Clay County, but that's the example across the state as the EPIs are following those.
I'm having a hard time understanding that as well.
Yeah, it's the community
Is it the
spread
riots you're
where,
talking about?
pardon me?
Riots? Is that what you're talking about?
Well, I'm not necessarily saying riots, it's just gatherings of people.
That's the only gatherings of people without masks that I've seen going on in Minnesota.
Yeah, well, and I can't, I am not privy to where the gatherings are happening. The Minnesota
Okay.
Department of Health is tracking that.
Yeah.
But that's, large gatherings, I don't know. But there are gatherings of people without masks. So
Boy, I sure haven't seen any.
yeah, I personally haven't seen any, but I'm not the one tracking that. Other questions about the numbers? You know, when you look at the numbers, and we have to be careful where we get the numbers, Minnesota Department of Health has the numbers for tracking specifically daily numbers. It'd be pretty hard for individuals to track those because only Minnesota Department of Health and local public health has the accurate cases on our med system. They are not public, and they're not for anyone else viewing, so we have to be very conscientious about the tracking of the numbers. So
when
we
the
follow strictly, I'm
So
sorry.
when Minnesota Department of Health daily releases those numbers, what numbers are those? If you're telling me that public health only has that number,
No, Minnesota Department of Health and Public Health.
okay, but you're saying they're not public.
Yeah, the active cases that we're currently following until they're all vetted through are not public. That's correct.
And so I guess that's just,
So there's a delay in the system is what I'm
so
saying.
the daily number is incorrect.
Yeah, it's a delay. It's not incorrect, it's just a delay in the system. Once you get the active cases, and you have to keep in mind, people get tested over on the Fargo side. So it might be a number of days delay. That's why it's daily, not You can't, if you give a daily number, there's still going to be some outlying cases out there. It's the way the tracking is. It's not accurate day to day because the numbers flow in as we get those cases.
So all of these, I'm going to go back to your comment about the testing being down.
Yeah,
And all of the testing that's done has been volunteer testing,
correct.
right? It's all volunteer testing. And going to what Commissioner Mojo just said just a couple of minutes ago is that the measures that were taken appear to be helping. It seems to me that if tests are down, maybe it's because people can't go anywhere. And there's no need to test, I'm just saying that that's probably a reality of what's happening right now because nobody can, unless you go to Walmart a lot or go to Menards a lot, so there's probably, in a lot of instances, there's not as much reason to be tested if everybody's just staying home,
Yeah.
and working from home. That's I'm not suggesting that's a bad thing, but it's being safe on their part. But I just think that to suggest that testing is down because people maybe aren't concerned about it anymore, and I'm not suggesting you said that either.
No.
But yeah, yeah. I mean, there's.
Yeah. I'm not saying that people aren't concerned or that the measures aren't helping. I'm just saying also you have to take into account when testing's down, then your numbers are going to be lower. So we have to take it's one package deal. It's not just one single item. Yeah, it's great for the people that are masking and avoiding, Thanksgiving. They expected a little bit of a bump up with numbers. There was some gatherings. Some people traveled. Some people got together, went out of state. There was those, and then there was many people that followed the guidance and stayed home, and we're not in large gatherings.
Well, I'm also really concerned there was just brief mention of that by somebody from the public this morning, but what this is doing to the mental health of our community. Mm-hmm. It's being locked up is not healthy.
Right.
I'm really concerned that where those numbers are going. We don't get reports from anybody on those numbers. Mm-hmm. I'm very concerned of what's happening there.
Right, we are too, and we understand even the businesses that the impact for them is devastating. We completely understand that. So we're not trying to be sympathetic of all of that. We're just trying to give you the accurate information about numbers and what we know. We don't know everything, but we know a fair amount about why the numbers are reflecting the way they do.
It's even interesting, as far as in my family, my siblings, they took a test, not to see whether they got it, but negative, but to see if they have the
Antibodies.
if they had it before, but I mean, I had a sister that she found out she had COVID, never had any symptoms or anything like that. So there's a lot of people out there that probably even have COVID that we have no idea about. I mean, I'm just
Correct.
saying one instance, but I'm not trying to make a big thing of that. But there's people out there more than likely that have had it that we're not even aware of, too.
Right. Some people have really minimal symptoms, and so they may not even think that they're positive. Yeah. They may think it's just another virus because their symptoms are so minimal. So we might see those people, maybe they don't get tested because they don't think it's significant enough. So the symptoms vary. Symptoms. Correct, or they have no symptoms. We do have cases where there's really no symptoms. They don't even realize they have it. So it's across the board, from none to.
That's why I say it's really spreading. I mean, spreading sometimes because of that. People aren't aware of it.
That's
that they have it.
Mm-hmm.
That's why we always got to be careful. Wear the mask.
You're right, and even in the grocery stores and any place that you go. That's correct. Other questions or comments about the numbers?
One last thing, Kathy. Who benefits by you and I wearing a mask?
both of us.
Thank you.
You wear a mask for yourself and you wear a mask for everyone around you. Absolutely. Okay, I'll have Jamie talk a little bit about our vaccination.
Can you hear me? I'm okay. Okay. Good morning. I just want to share some information on the rollout of the vaccine in Minnesota. Governor Walz's Minnesota COVID-19 peacetime emergency extension has allowed us to continue to work on that vaccine rollout. Minnesota Department of Health is working with local public health and regional healthcare coalitions to implement a phased-in approach to the vaccine delivery in Minnesota. Phase 1A pushes vaccine out to healthcare personnel and residents of long-term care facilities. Priority for healthcare personnel starts with occupational risk of exposure to COVID-19. Phase 1A includes 3 priority areas. We are working on each of these priority areas on a weekly basis and given tasks to complete in order to assist the Minnesota Department of Health in getting vaccine out to our area. Priority 1A, in 1A, Priority 1, where we are right now, that focuses on healthcare workers providing COVID care to individuals, and that includes long-term care, nursing facility staff, emergency medical services staff, COVID testers, and COVID vaccinators. And so that's where we are right now, and that's where the first amount of vaccine will come out. The second priority will focus on those same healthcare providers, but those with less contact with COVID individuals. And then thirdly, priority 3 in 1A will help us to get vaccine to all other individuals in those healthcare systems. Minnesota Department of Health will ship vaccine to healthcare providers, local public health, and regional healthcare coalitions for administration in our area. There also is the Federal Pharmacy Partnership Program, and those 2 programs are working alongside each other. The Federal Pharmacy Program, the PPP, is actually a partnership with the federal government and with pharmacies to vaccinate long-term care residents and staff. Initially, the focus was on long-term residents and not staff in hopes that they would already be vaccinated as healthcare providers, but that's an opportunity for both. And so those 2 tracks are focusing on our healthcare personnel and our most vulnerable individuals in our long-term care. Local public health is currently working with regional healthcare coalitions to identify and plan for serving long-term care staff and residents not registered under the PPP federal program and EMS providers not affiliated with a healthcare system, and also the community vaccinators. So that is our task right now from the Minnesota Department of Health. They're hoping that with the PPP program, they can catch most of those healthcare providers and residents of long-term care. If they weren't able to register for that, we're identifying them to serve through Minnesota. And then also emergency medical services providers that are not part of a healthcare system. And so that's our task for this week that we're working on. And, you know, if I'm not going to go into detail on the vaccines, but the Pfizer vaccine is one of the vaccines that's being rolled out, and we're anticipating Moderna as well. Vaccine, we're told, could be coming in the next week or so. We don't have exact amounts, and we don't have an exact time frame.
I can just share, and I apologize, Jamie, because I got the call right before I came over here from the Minnesota Department of Health. But they expect that our community health boards, so that is Clay, Wilkin, Ottertail, and Becker, will get a shipment of vaccine next week. It's around 400 doses for the 4 counties. So that's the initial around 400. They can't give me an exact amount. So if you think about 400 doses with 4 counties, we're not going to get a whole lot of vaccine to begin with.
So that's 200 people.
Well, no, I'm sorry, Commissioner Campbell. They are going to withhold, they're going to not hold back. They're going to give us our shipment of 400, and they want us to use all of those 400.
On the
and
first
in the
application.
following week, they'll ship us the next 400 to manage the following week or 2, as the second dose comes 3 to 4 weeks later. So they will give us the second shipment. They won't ship us I think you asked the question last week too. They're not going to ship us the 400 and tell us to hold 200. So they'll give us the second dose shipment in the next shipment coming. But we'll get it in plenty of time to give people the second dose. But so it's still not 400 doses across 4 counties is not going to be initially very much. So we will have to focus, we'll be planning, we're going to get it sometime next week. So we need to plan where that may go. The recommendation is for sure those that may do the vaccinations should be the first ones to receive that. So we still need to work within our incident command team to determine where those go. But it's not a lot. So that just came at 8:25.
So similar to our experiences with H1N1 vaccine, we'll get a amount of vaccine, we'll be told the target population, and we will get it out to those individuals, and then the next round will come, and that'll be that same process. So the difference is there are a lot of partners with healthcare and pharmacies. There are a lot of engaged partners.
Any other questions on the vaccine or anything else that?
So that 400, so that's going for the 4 counties, but is there additional that goes directly to hospitals and clinics?
Yes.
That's separate, right?
That's correct. And that's the really ultra cold, so difficult to maintain and manage, and really only the health facilities have the capability of keeping that ultra cold. So as you saw in the news probably that Sanford already has their ultra cold and providing their vaccines, and so the health facilities will get that. The nice thing about the Moderna is it's frozen, and so we have the capability to easily manage that vaccine.
Okay, very good. Thank you for your update again.
Thank you.